Brent, you're muted.
Are we ready? Okay. Ready to go?
That then.
All right.
Great. So welcome to our management forum for May. We have a special guest today, of course, and we'll also bring you up to date on where we are with COVID, where we are with the capital projects. But first, let's turn it over to Susan. Susan, you're muted.
You'd think I would have that down by now. Okay, restart. Good morning, everybody. Happy May. I am so excited that we have our Department of Public Health Director, Dr. Grant Colfax, joining us today. I'm going to say a couple words of introduction, and then I know he'll want to share some remarks. I also know that he is very interested in having an interaction. So I know you guys aren't shy. So please think about your questions and have them ready for when Grant is done with his remarks. So Grant Colfax joined us as the DPH director. I was just looking back at this in February of 2019. And he came to us from after having been the head of the Marin Health Services Agency, working in the Obama administration with HIV/AIDS. And Grant was a resident at ZSFG and UCSF in internal medicine, and his area of expertise is HIV/AIDS. So with that, Grant, thank you for joining us, and really looking forward to hearing what you have to say this morning.
Great. Thank you, Susan, and good morning, everybody. It's great to join you for this meeting, and I hope that it's sometime soon we will all be able to meet in person and see each other in real life. But given where we are right now, I just wanted to stop in virtually and have a conversation as much as we can, given the limited time, about what your concerns are, how I can be a better director for all of you, and of course the people we serve. Obviously, it goes without saying that I am incredibly impressed and grateful for the work at Zuckerberg during this last 15 months in particular. And no exaggeration to say Zuckerberg is a national and I think world leader in terms of how to handle COVID-19. It's just remarkable what you and the team has done with regard to caring for people with COVID-19, developing protocols, being on the front lines, improving care, doing the research, reaching out to community. I mean, from the very beginning of admitting people and figuring out how to best care for people to rolling out the vaccines that we know are a ticket on the way out has been incredible. And I haven't been able to see a lot of you during this last 15 months, but just to say, I do stop by at the hospital with some frequency. I have clinic at Ward 86, seeing patients, so I've had the pleasure of interacting with some of you. But I also think the 15 months, we've also almost had a normalization of how heroic the efforts have been. And I don't expect any of you to necessarily step up and say, you are the heroes or sheroes of this work. But I think it's important to remind ourselves what we've been through. And there are very positive things with regard to that. And there are also, I think, some really challenging pieces as we come potentially to a new level of COVID-19 control. We're in a good place right now throughout the city. But I also just want to make sure that we're taking care of ourselves and each other during this time. I took a few days off just over this past weekend, and it was remarkable. And it was a little weird to have some downtime and not to be checking my phone and not to be, I have to say, I took 48 hours not to look at the COVID numbers for the first time in 15 months. And it was really healthy. And I realized how much we need to make sure that we're caring for ourselves so we can care for others better. So just wanted to share that and make sure that you have the time that you need. I also think it is important to realize that the department and perhaps, and you all are closer to it, but I would suspect the hospital has changed forever by this experience. And I would really use the history of what we did with HIV/AIDS as a city, as a hospital, as a potential blueprint for how we're going to move forward with regard to this COVID-19 post-COVID-19 response. And when I say post-COVID-19, I don't think we're ever going to be truly post-COVID, just as we're not truly post-HIV/AIDS, but I am hopeful that the worst is behind us. So what are the strengths that were revealed in the hospital and across the department that we want to carry forward? I think the department came together like never before. The incredible work that many of you have done at COVID Command and continue to do, and I want to thank you all for deploying there. And we didn't know how long it was going to be. We still don't know how long it's going to be for some people, but just that work and the connections that were made across the department and also across the other city departments as well. We are more integrated than ever before. We know, I think, more people. We have more connections to do our work. And so I think that's a real strength that I'd like us to continue to carry forward. Certainly the appreciation in the city for Zuckerberg has never been higher, as far as I know. And again, I think that's not only well-deserved, but it's also something that we want to strengthen and grow. I think the work with the community, and particularly the Latino community, given the inequities in this pandemic, that work has strengthened tremendously. But we also have learned so much more about how to work more effectively with community in the neighborhoods most affected by COVID-19. That went beyond the health department, went beyond the hospital, but how do we carry that forward, and how do we really think about strengthening the work across the city with the social determinants of health, which of course include the primary care, the medical care that you provide at the hospital, but also how do we strengthen food security interventions? How do we strengthen preterm birth interventions? How do we continue to work on so many of these issues that we know have been at the forefront of public health for many years, but the pandemic only highlighted. And finally, I just want to say that in this next stage of our COVID-19 response and figuring out how do we need to sustain it, we are going to be continuing in a state of change and some degree of uncertainty. And I know that that can be really challenging as we go forward with our work, but there is no before, during, and after here. This is really going to be a continuation. So one of the key things that I'd like us to think about as leaders is how do we not only take the broader strengths that the COVID-19 brought out in our department and in the hospital, but how do we provide opportunities for people who really stepped up during this pandemic to continue to grow and learn? So many of our team members were put in new roles and stepped up and showed incredible leadership. And how do we manage the bureaucracy around that as we go into this next stage to continue to support opportunities for people? Because I think while so many of us work so hard and we're sort of looking forward to taking some downtime, which is good, there's also new skill sets, new horizons that people never realized that they had before them. And so how do we provide that opportunity for our team going forward so that we can really, again, build on those strengths? So that's really what I wanted to say. Thank you for saving lives. I know that Zuckerberg does this every day, COVID or not, but our death rate in the city because of Zuckerberg and our other healthcare partners continues to be among the lowest of jurisdictions in the United States, if not the lowest of urban jurisdictions on the mainland. And again, the work that you've done has beaten back the 3 surges. We're at 74. I think we're going to get at 75% today of vaccines into arms, first shot. 87%, 65 and over. So it's just been remarkable. In addition, you did all the other work that we know is so important. And as we continue to build on our COVID-19 response and sustain, again, the strengths that COVID-19 brought out, I'd like to hear from you what you need. I'd like to hear from you about the challenges, and I'm here to answer questions that I think, Brent, you're going to help navigate, correct?
Susan,
Okay.
Susan is going to narrate for you.
Yeah, Grant, that was really lovely. It's so nice to have you here with us and to see you, albeit virtually. Really glad that you got a few days off. Yesterday, I spent some time with the executive team asking them what they're looking forward to, and all of them have vacations planned. So really glad to report that to you. And I do want to just reflect on your gratitude to Zuckerberg and put that back at you, because as I've thought about the hospital and what we were able to do here for patients and community, it really wouldn't have been possible without the support of DPH and the larger community. And that's because even though we were incredibly full and more full than we ever were, since we moved into Building 25, we were never overwhelmed. We were never in the position that hospitals in New York and New Jersey were, for example. And that allowed us to really provide excellent care. And we weren't overwhelmed because of the way the city responded to the pandemic. As you always say, using science, data, and facts to guide what we do. And that meant that we had a lower case rate, we had a lower death rate, and the community went along, which is also a really remarkable thing in this day and age. So I want to express a lot of gratitude to you for your leadership during the pandemic. I was thinking, you came to us in February of 2019. Little did you know, or could you imagine that exactly 1 year later you would be leading the department's response to a global pandemic. I can't imagine what that must have been like a year in. But I do want to follow up on one comment you made, because I don't see any questions yet. I'm gonna ask them myself until we see them. But you said we'll never be post-COVID, and that resonates with me. And I wonder what you think specifically we learned this past year, and what learnings are you hoping that we can carry forward into the future?
Yeah, well, I guess I meant that metaphorically and concretely as well, right? Because I think that, I'll start with concretely. Most people believe that COVID is here to stay now. Unfortunately, we're past the time of elimination, right? So the vaccines, whether or not we need boosters is still, I think, up for some debate. But COVID will always be here, and I think the flu model is most likely to be where we're headed, right? So people in the hospital either incidentally found to have COVID, or some people will still likely get sick and have some bad outcomes from COVID-19. But I think it will increasingly be a more manageable disease. So concretely, that's what I mean by there is no sort of post-COVID. I think from the metaphorically, I just think our culture as a department has changed in terms of, again, the connectedness that we've had. I think it's a bit of a cliche, but I think if any, it is a cliche. We're stronger together, but I think we never really were able to make the connections and working together like we did this year. So I think from the perspective of the population health side of the department, from the primary care and clinic side of the department, how do we continue to engage in concrete ways with the hospital as a partner in the work that we're doing? So I think that's been really key. And I'll give you a concrete example. I referred to it in terms of working with the Latino community, right? There were a number of, in collaboration with UCSF and the Latino Task Force and others, there were a number of testing sites that were established fairly early on in the mission in other parts of the city that then became vaccine sites, and when we had vaccine availability. And it was just fascinating to me to see that work that was so incredibly important, and also that Zuckerberg is there not far away from a lot of these sites, and it wasn't necessarily seen as an accessible resource, right, by some people in the community. And I think due to your work, Susan, and others on this call, and a lot of work in the community, there were new relationships made, and things, and bridges were literally, well, not literally, but bridges were built in a way that would not have happened before. And that's where I see us continue to strengthen our work, so that there's a clear mechanism by which we engage community members and others in accessing care that could be certainly the tertiary care that Zuckerberg has always provided, or perhaps the more sustainable, longer-term care that we know is so important as well. So I just think that that's a concrete example. Another example would be a COVID command. I mean, we have advanced planners from Zuckerberg applying lean principles on a daily basis with our COVID-19 planning. That has now infused a whole culture, not only, well, it's the culture of lean and that planning was spreading throughout the department, but I think it was spreading from Zuckerberg as the center of that, right? That has now spread throughout many of other city departments, right? So there are whole groups of people, not only within DPH, but in other parts of the city now who have familiarity with how to do these practices. So I think that's another example of where things have been tangibly shifted. And then just the fact that on our city data tracker, I mean, the city data tracker is like, it's public health, right? I mean, nobody before now, except for a few public health nerds like myself, would go to the city data tracker and look at, what's the latest data on public health. And now that's where so many of our citizens of the city go to. So I just think it's that. And then finally, I would say that our connections and intersections with the other health systems in the city, I think, are unprecedented, right? And there was some push on that, and yet our other partners, particularly Kaiser, Sutter, Dignity, and of course UCSF, which we've always had that special relationship with. But I think the UCSF relationship was even further strengthened. So that was a long answer to your question, but I think those are some key examples of how our work has changed compared to where we were February of last year.
Yeah, that's great. I'm so glad to hear you really appreciating the lean philosophy and tools. We had that reinforced also by the Joint Commission surveyors who came, and we're so glad that that's spreading throughout the city. Okay, we have some questions now that we'll be able to dig our teeth into here. And a lot of this goes into what's happening with things other than COVID, which is great because we want to go there. So there's a very concrete question that I'll ask you first, and then we'll go into some other things that are more expansive. So question about the vaccine for kids 12 years and up. So once they're allowed to be vaccinated, would you recommend doing it despite all the study limitations?
Yes, we are recommending vaccinating children 12 and up now. As you know, I think people know that FDA authorized an EUA yesterday for 12 to 15, and the vaccine team is going to be rolling out that effort. But absolutely, 12 and up, we recommend vaccine. These vaccines are highly effective, very safe, and the benefits far outweigh the risk at this point.
And thank you, Grant. And I will say we have a very welcoming and beautiful place for our 12 to 15-year-olds up in 4E. We have a family waiting room. We have a teen selfie wall. The team has just done an outstanding job to welcome 12 to 15-year-olds when we're ready to do that. Okay, let's move to security. We had a long and very interesting Health Commission meeting about Director Price's new plan. So could you tell us more about the new security model for DPH and the process for rolling it out, and how we're going to do that in this environment where there's a lot of different opinions about security and the role of law enforcement on campus?
Yeah, so I think that the new, as we move to decreasing law enforcement's presence across DPH, and again, there are a lot of details in this that Director Price went over at the Health Commission meeting last week, and I believe, and Susan, you can talk about what will be shared or what's already been shared at the hospital. There have been a lot of conversations about this, right? And certainly from the department side, and the Health Commission endorsed this, we see an incredibly important opportunity and a need to decrease law enforcement presence where really law enforcement is not justified, and that the model of care is not to have uniformed officers in many places where they have been in the departments, and in some cases where they continue to be. So there are a combination of things that are going to happen, and again, the details can be shared later, but particularly in our primary care clinics, law enforcement, uniformed law officers, for the most part, will not be present. They will be present in a limited capacity. They will be available in case of of a situation, but they will not be in most of our clinics stationed, right? So we know that that's traumatizing to our patients. It's traumatizing in some cases to our staff, and we know that that's not the standard. So we're shifting that. It's taken a long time, and I know I would expect that many people on this call have been actively involved in those conversations. We will also be within the sheriff's department. We will be using cadets in a limited capacity, but those cadets will not be sort of outfitted in the traditional law enforcement uniform. So really working to decrease the visibility of that law enforcement presence, and also be trained in techniques that are much more consistent with the standard of care, right? So not a law enforcement lens, but a trauma-informed lens, a de-escalation lens. And we're going to be monitoring the results of this work, right? So Director Price has very much shown with the data that there's an equitable application of force across the department with regard to application of force against patients. And that's something we're going to be looking at very carefully. So there are a number of steps that I think are long overdue in the department that we are making, and I want to make them as quickly as possible. Obviously, the bureaucracy gums things up a little bit, but we're pushing through, and the Health Commission was very supportive of these changes last week. So this upcoming July 1st fiscal year, I think we're going to see some really tangible changes going forward. And I'm happy to go into more detail if needed or provide more information later.
Yeah, that's great. And just to share, we heard from the Sheriff's Department this morning that the cadets training, the expansive training in trauma-informed care, de-escalation practices, all of that, that's actually starting now. So our cadets on campus will be trained, and the training is somewhere between 30 and 40 hours for each cadet. So that's going to be really substantial, and that will just be to start. So really looking forward to that change in overall practice. We have a couple of questions related to the department's strategy in meeting the mental health needs of the chronically mentally ill. So Grant, can you talk about what's happening right now with mental health SF, and in particular how that relates to the hospital, or how you see that relating to the hospital, and then even more particularly how it might relate to the people who we have waiting on campus, either in med-surg or in acute psychiatry for other types of placements?
Sure. So behavioral health is a key priority for me in the department and the city, and I know it's been at the hospital as well. So there's a lot going on, and I think we have huge potential right now to transform our behavioral health system. There's strong political support for it. There are policies that we are starting to execute to develop and transform, to develop new interventions to transform our system. I think we also need to build on what's worked, but also acknowledge that we have to radically change some things. One of the big things that we've done structurally in the department is elevated behavioral health to the highest level of the department, reflecting the political, policy, and strategic focus of behavioral health. And along those lines, we have recently hired our new behavioral health director, Hillary Cunnins, who is a deputy health commissioner in New York, focusing particularly on behavioral health with regard to substance use and overdose prevention. So given that more people in San Francisco died of overdose last year than of COVID-19, I think it's just incredibly important that we focus on this pandemic, public health pandemic. So we've elevated the level of leadership, we've brought in new leadership, and I would just say that one thing that is important to emphasize, we haven't had a permanent behavioral health director for a number of years, and we've had, I believe it's 4 or 5 different behavioral health directors in the past 4 or 5 years. So really strengthening that work and that position has been a key focus even during the COVID-19 pandemic. The investments that we're making with regard to the behavioral health work is a whole spectrum of things. And I think it goes to sort of the focus on harm reduction and meeting people where they are and where we are, but also to ensure that we are providing people with low barrier opportunities to get into care, and also working to provide not only the opportunities, but also to work with families and neighborhoods to ensure we're addressing the behavioral health issues, recognizing that it's obviously, the people suffering from behavioral health issues have to be the priority, but there's also many overlapping effects of people's illness in the broader context of a neighborhood and a community. So how do we acknowledge that? And how do we work with our partners across the city to address that? So I think some of the things that we've been working on that are new, that I'm excited about, are our drug sobering center, right? So that's going to be a place where people can sober up, particularly from meth, and potentially be linked to treatment. So that's a really important and exciting development. And we're starting with one center, but we hope to expand. There's a street crisis response team, which I don't know if people are familiar with, but it's a collaboration with the fire department that has paramedics and behavioral health specialists literally roving the streets, stopping when they see somebody who appears to be in distress, engaging, providing opportunities for them to be linked to care or to be transported to a treatment center. So that's really meeting people where they are. We're excited about doing safe injection sites, which with the Biden administration, we are waiting, and we're also waiting for the state to hopefully enact laws that will allow safe injection sites to happen. Because, I have a clinic up at Next Door Shelter up on Polk Street, and there are a number of tents that are still on the street. And I think those are sort of the de facto injection sites for many people, because it turns out that many people are, staying in shelters where they can't use, and they go into the alleys under these tents and use. So I think that that's another important step. And then really lowering the bar as much as we can around the bureaucracy to get people into care. I don't know about what you all have seen or experienced in accessing the behavioral health system, but it can be like going to the DMV. And I mean DMV, not online DMV. I mean actually going to the DMV. I mean, it is there's so many barriers and there's such a bureaucracy. So with mental health SF, we're hoping to be able to provide flexibility in terms of people being able to access treatment in real time. So we really realize that vision that San Francisco has had, which is treatment on demand, right? So how do we continue to build that? And that's also part of our bed expansion. And I think, Susan, this gets back to your question about people waiting for beds in the hospital. There are a number of beds that are being expanded. Mayor Breed expanded the budget in 2020 expanded beds considerably. We're continuing to do that. So anywhere from the residential treatment beds to the locked beds, there's an expansion in those investments, but also making sure we're using those beds efficiently and effectively. And what gets measured gets managed. So we continue to develop data trackers that show us the availability of beds, the occupancy time for beds, and that flow is so important. And that's never been as transparent or as accessible as it needs to be. So we're building that system. Quite frankly, it was very hard for people who were not spending 24 hours a day on bed placement. Beyond that group of people, there wasn't a transparency, there wasn't accessibility in terms of that. So now we're going to be developing those systems so we can actually measure and manage those in a much more effective, systematic way. So the knowledge in that work and those investments belong to a system of care rather than, what has historically been some people, several people, outstanding people, but they really sort of held that information. It wasn't really fair to them or appropriate for the system. So mental health SF is a big step forward. And the last thing we're developing just in terms of this is an Office of Coordinated Care, which is actually going to be sort of ground zero for these coordinated efforts like the beds that I was just talking about. So I'm very hopeful. I do say that there's still a place, and this is a public health question, but it's really a social question. What do we do? How do we address the challenging patient people who have behavioral health issues, who continue to refuse treatment and are not at direct harm to themselves or others in an acute way? That is still something that I think as a society that we need to work to figure out. Part of that could be working with HSH, our housing Department of Homelessness and Supportive Housing, to provide opportunities for people to be sheltered while they continue to use. I mean, we know most substance use in this world happens with people who are housed. So I think that that's another key piece that we have to look at, because as much as behavioral health on the street is an issue in San Francisco, that's directly related to our housing crisis in San Francisco. So working to better improve that is going to be really key, because we know that no matter how much we work and engage with people, provide treatment on demand, treatment is an answer for many people. Many people will get there, but not everybody is going to get there at the same time. That was a long answer. But
no, it's great. That's an incredible vision for a mental health system that hopefully provides, as much treatment as possible in the right time, in the right place, and mostly that's out of the hospital. So that's a great vision. There's two more things. One is a level of detail about the security plan for here on campus that I think I'll just address myself. So first, there will be crimes committed on campus, and we need a sheriff's deputy's presence for that. And it's great that we have the close partnership that we do with SFSD, and in particular in the ED and the PES, we will continue to have deputies posted there, because that's where the crimes are committed when, typically when they are committed on campus. So that's important. But with a small reduction of deputies in other places on campus, we get a great big increase in the BERT team, and to a lesser extent, patient experience staff on campus. So I think it's more about matching supply of people to respond to things with the demand that we see. So a fewer deputies, a lot more BERT team, and a lot more patient experience team, and the deputies remain in the ED and PES. I think that addresses one question. And then the last question we have is a controversial one. Would the department have COVID vaccination be mandatory when the Pfizer or Moderna COVID vaccine are fully FDA approved? What are your thoughts about that, Grant?
So I think we're still evaluating what that policy might look like, and Dr. Susan Phillip, who is our new health officer, is looking at that and talking to a number of people across the department in terms of the pros and cons of that. So we're continuing to determine whether that would be a recommended policy or not. So I think that the key thing is these vaccines these vaccines are great. They're actually working remarkably well in the real world. I don't know if you look at the data from Britain and Israel in particular, plummeting cases, plummeting deaths. And I just think if we're in public health, it's really incumbent upon us to champion these vaccines. It is incumbent upon us to champion these vaccines, both with our patients in the community, and of course with each other. And if people have concerns, and I have heard concerns, and I don't, I think those concerns are things we need to listen and have the conversations. But each of you at the hospital can play a key role being associated with, an anchor institution, a trusted institution in San Francisco to champion vaccines. So we've had very, very high uptake among DPH staff overall, including at Zuckerberg and at Laguna Honda, which is great. So I think we're really leading in that regard. And again, a policy on mandatory vaccination or not is something that hasn't been developed yet, but it's certainly under consideration.
Great. Well, I think that's it.
I have to say one more thing.
Oh,
Just
please.
because I know you had surveys on the last week, and it's just, it's incredible. I do read those emails. And congratulations to the incredible work that was put forward, and you really shined. So outstanding work, everyone. I know those surveys are really challenging and put a level of stress on the system and all of you, but remarkable. I'm very, very proud of that. So, and please, you should be proud of that too. Congratulations. I know that I heard that people are like, oh, it's hard to believe this is a public hospital. And I will say that I'm just so impressed and grateful that Zuckerberg stands as an outstanding hospital implicitly in that work. It's not, we're a public hospital, so we do this because, and we don't hold ourselves to the highest standard. And that's just incredible. The patient experience, the research, the commitment, the expertise, and the work with the community is just incredibly impressive and will continue to be. And I mean, I'm a little biased, but I believe strongly that Zuckerberg is the best public hospital in this country, if not the world. And it's because of all of you. So thank you.
Well, I won't disagree with that assertion. I couldn't be prouder of this place and our team, and I really appreciate your acknowledgement. It means a lot to our team, and we really appreciate your time, your leadership during this incredible year and a half. And we hope you'll come back and visit us again sometime soon.
Absolutely, I'd be happy to, and stay strong, stay safe, be resilient, take care of yourselves, hug your loved ones, help people get vaccinated, and thank you.
Thank you, Grant. Take care.
Bye.
All right, that was very exciting. Let's see, Brent, I'll turn it back over to you for the rest of the agenda.
Wonderful. Thank you so much, Susan. So why don't we check in with Lisa? Lisa, could you give us a really brief status update on where we are?
Yes, thank you, Brent, and thank you, Susan. I will be brief, noting the time. So just in terms of some perspective, as usual, try to think internationally and then move closer to home. In some places, as Grant mentioned, the UK, Israel, and several other places, things are improving, but still very concerning in a number of areas. I think most people have really looked with horror at what's happening in India, and cases continue to rise also in Southeast Asia. So pleased to see that the US is, really trying to think about what we can do to help in terms of particularly providing vaccination support in other places. In the US, we're doing well overall. Cases are falling in most places, although they're still higher in certain areas like Oregon and Washington, the upper Midwest, Florida, some of the Northeast. And deaths, perhaps not surprisingly, are falling more slowly than cases, but overall doing pretty well. And California has stably looked good for quite a while. As Grant mentioned, 74% of folks in San Francisco who are 16 and older have received at least one vaccine dose. And the MMWR just released some US data today for adults 65 and older across the US. 79% across the US had received at least one dose. So good news, although there is certainly variability from place to place. And now a lot of room to, try to make progress in terms of younger folks. And we and others are really now kind of adjusting our vaccine rollout strategies to reach those that are more difficult to reach in addition to those who are, still coming to large vaccination sites, like our vaccination site here in 4E. As was mentioned, the FDA has approved Pfizer emergency use authorization for 12 to 15-year-olds. We can't start using it quite yet. So the Advisory Committee on Immunization Practices is meeting, we think, on Wednesday. We expect they will offer a ringing endorsement. And then we'll need state and local approval. But we expect we'll probably be able to vaccinate 12 to 15-year-olds by the end of this week. And people are really excited about this because, of course, in some families, the adults have been vaccinated in some cases for a while, but it's a little difficult to navigate if the whole family has not been vaccinated. So this has really been very eagerly anticipated. And the last month we talked about the Johnson & Johnson pause that has now ended. And so we have all 3 vaccines available in San Francisco. On our campus, we're actively continuing to vaccinate in 4E. The Learning Center closed, but still very robust outpatient vaccinations in 4E. In addition to inpatients, some of our clinics and now offering vaccines in PES, which we're very excited about. And just putting in a plug that staff vaccinations are still going on Tuesdays in the Wellness Center from 8 to 3. We're still really actively trying to vaccinate staff who have not had a chance to access it yet. And then what are we doing in terms of planning for de-escalation? And I know that, depending who you talk with, some people are like, well, why haven't we just de-escalated, completely? And others, are, very concerned about each step that we're taking. We're taking it in a step-by-step approach. So I think people have noticed that we're no longer requiring temperature checks. That has been shown to be quite safe in terms of not having that be a requirement. And starting May 17th, pre-procedure testing is going to end for fully vaccinated patients. That's been a real challenge for some of our patients, so we're really happy that we can offer that. But we have de-escalation planning still in progress for things like testing, meetings and gatherings, and screening. So I think we'll have much more to come over the short term. And then the last thing I will just very briefly mention is about variants. Where are we with variants? Lots of new information kind of coming out every single day. But in a nutshell, variants have become common in the US, particularly the B.1.1.7 variant. And if you have to kind of summarize in one sentence, I would say that one of the challenges with the variants is that some of them, including B.1.1.7, do seem to be more infectious than the original strain. And that may be one of the things that is continuing to fuel outbreaks amongst younger people who are not immune. But thus far, the data for the common mRNA vaccines, the Pfizer vaccine and the Moderna vaccine, have been pretty encouraging that even if they aren't quite as active against all the variants, they do seem to still provide robust protection. So lots of continuing enthusiasm for the vaccine effect. I'll stop there. Thanks, Brent.
Thank you, Lisa. We may get to questions, but first let's get to Terry Saltz to talk about what's going on campus.
Okay, thank you. I will put up my presentation that I made for this event. Let's see.
Brilliant.
There you go. Okay, good morning, everybody. This is a presentation of some of the things we have going on. Actually, we have a lot going on, and this is just the highlights of the things that I thought would be of interest. it's apropos that we're talking about security, because the first thing I have up here is security projects on campus. We have a security project at Building 2, which is meant to reduce the risk that we have with the back of the power plant being exposed to anybody who enters that corridor in Building 2. I know a lot of people don't go to Building 2, but those that do, to use it to access the parking up on the rooftop or have business in Building 2. It's quite, the corridors, the back of the house is quite open. And what this project is going to do is it's going to create a vestibule with a transaction window so the public can access the engineering desk through a transaction window in the elevator lobby rather than getting into the back of the house. And it provides some extra cameras and some more security features. That job is permitted. The contractor is on board. They're just exchanging some paperwork before they actually get started doing that work. The patient safety project, the mezzanine safety project, I'm sure you've all seen this, the kind of the construction barricades we have on the mezzanine of Building 25 as you walk from Building 5 to 25 or vice versa. That project has been a long time coming. I think this is like the first post-rebuild project that we initiated. It's foundation funded, and it's meant to create a 7-foot glass barrier between the pathway and the mezzanine balcony. That project has some last anchoring details that have to be approved by OSHPD. The glass has already been manufactured and received. So you're going to start, as soon as that gets approved, you're going to start seeing that glass going up, and it'll look a lot neater real soon. And we can get rid of the magic red rope after this project is done. Campus access restrictions, that's part of when we talk about de-escalation of COVID, part of that is, we've instituted a lot of access restrictions, as you well know, that we've funneled everybody into the main lobby of Building 25, or the main lobby of Building 5, or the entrance to Building 80-90. There's a desire to keep the building restricted to people who have business in the building. And so we're trying to work through that and figure out some plans to keep that going while also addressing logistical needs of the seismic project, which I'll be talking about in just a bit. The next slide is about the rehabilitation service relocation project. This one is so close to being done. This one, as you see on the right, there's pictures of as far as the pictures are concerned, the upper left one is the new reception area and waiting area. The one to the right of that is the new corridor that's going to go from elevator to elevator, kind of similar to how building or the 4th floor is configured, where there's a corridor down the middle between the elevators. Once that gets opened up, we'll have a direct access down that corridor. And then down below is the gym. It's a shot of one view of the gym. It looks big, but once it gets filled up with equipment, it'll become small real quick. So we have a transition phase that's going to come up as soon as we get occupancy from OSHPD. We're just doing the air balancing and fire alarm testing, and then we'll be able to ask for occupancy from OSHPD. That occupancy is not the move. The occupancy is for us to do the facility fit up. We can get equipment in, hang things on the walls, go through the training, and get licensing on board. So that's going to take a couple months, maybe up to 4 months to actually get that done and actually relocate rehab to this beautiful new location. As soon as we do get the occupancy, though, we're not going to wait for that relocation. We're going to get started on the dialysis relocation project, because dialysis team is very eager to get out of Building 100 into a modern facility, and that's what we intend to deliver them. That project is currently out to bid. We received them this week, and we're evaluating the bids on that, and so more information on that in the future. The next slide is about our 6th floor construction that's meant to be an office surge space. Now, this is a very nice kind of open office plan, which was very much in style pre-COVID. Now, with COVID, we have to rethink about the layout. If you look at the lower right-hand picture, those are workstations that were, they're sit-stand workstations, which were meant to hotel people. But now with COVID restrictions, we have to rethink maybe adding some barriers or maybe spacing them out, maybe reducing the occupancy that we originally foresaw for the space. So more on that as well as this gets completed. But this thing is almost there. We're just going through the fire alarm testing needs to be completed, and we'll be able to use this space. The seismic retrofit. So this is an interesting picture. I chose to put on here. What this is it's a modeling tool that the structural engineers use to identify. I'm sorry. Getting back onto the picture. This is a structural modeling tool where they model the entire structural elements of the building, and they overstress it to see where the points of stress are. And you can see the red and the green and in this picture. Those are all points of stress that need to be addressed in the seismic retrofit. Now, some areas will have to be strengthened, and other areas will have to be relaxed. And so it's just kind of all over the building. We've already done the south side, and now this is out to bid also. And as soon as we have the bids awarded, we'll be able to nail down a schedule. But the phasing plan right now is to have some early scope in June is going to happen, and the first interior work. But there's going to be interior work and there's going to be exterior work. We're trying to do as much of the work that we can on the outside of the building, so it does not impact the occupancy inside the building. So the interior work you'll see first in the OPD lobby and pharmacy in the basement below there. That'll be the first area of the interior work, and I don't have a date on that yet, but when I do, I'll be sharing that. Exterior work will begin on the west side, and that's probably what you'll start seeing in June, is probably some setup and some early mock-up of that sod cutting that has to happen on the west side, starting from the main lobby. If you look at my cursor, this is the outpatient lobby. This is the main lobby. So pretty much this whole area here will be some exterior work will start. And then there's a lot of planning right now. Some of you have been involved with this, with relocating the M-wing operations, the clinics, to some temporary clinics in the main body. So there's a lot of work that has to happen right here along this this corridor between the main hospital and the M-wing. And when that happens, there won't be any access across the corridor, and there's a lot of systems will be impacting the clinics, and so it's better just to relocate them for 6 months and then bring them back in. And so as I mentioned before, the work is going to include column strengthening, sunshade removal, and then increasing that expansion joint, which is located right here. That's the highlights for my projects. I wouldn't be doing my job if I didn't give a shout out to the San Bruno parking lot. We still have some space available out there. It's a great alternative, or it's at least an alternative to the congested parking on campus, and it's less expensive. And we go to a lot of DPH goes to a lot of expense to maintain that lot and to provide shuttle service at the peak hours in the morning and the afternoon. The next item, I'm pretty much done. The next item is the UCSF Research Building, and I'm going to pass the baton over to Ken Humphreys from Bolt Construction, who's responsible for the working with the UCSF Research Building.
Well, thanks, Terry. I'm going to share my screen. Get some feedback. Good morning, everyone. Pretty quick update today. I wanted to share these beautiful new renderings. Hopefully everybody can see my screen. Okay. So new renderings. This is virtually what the building is going to look like with the color schemes and the pattern. It's a handsome building. So a few different elevations. From the west, that'll be the main entrance and lobby, your town centers, your open communicating stairwell all the way through the building. And then look into the lobby itself from the south looking north, with and without people. And look from the north looking south. So it's a nice space to congregate and while people are waiting to come into the building. Few more pictures. I want to show some nice pictures of our topping off celebration with the beam that a lot of you signed. The tree that is being planted on campus, I understand. So being resourceful there. And of course, the traditional flag. And that's the last piece of steel going in place. The steel erection for this building lasted 5 weeks. So you think about 5 weeks, they installed 175,000 square foot, 5-story building with penthouses, which is incredible. So we had a really good steel erection team. And that's what it looks like now. So the current work that we're performing is we're starting to do our MEP supports up on the decks. We'll start on level 2, and we're penetrating the deck to support overhead in level 1. We'll be working back and forth through the building all the way up. And the concrete pours will start after that. So they'll set the rebar and then start pouring the concrete. That's going to be an important milestone because once we have the concrete all the way up through the building in mid to late July, the noise factor is going to be reduced substantially because the noisy part of this construction is this metal decking and the steel hitting the metal decking and hammering on the metal decking. And we're working with Terry on helping in a few areas on level 3, I believe, on building 5 to start. And we're ordering some material to dampen the noise that's penetrating into that space. So late in during September will be when this whole side of the building will be covered with the exterior skin system and windows, which will further eliminate noise going into building 5. The roadway project is essentially complete, and we're just doing some punch list items on that, and there will be a succession plan that Terry could probably share in the next couple of months, I guess. But the work on this north side is going to be very limited now to within the boundary of this red curve. So we do have a little bit of fence work around the air enclosure for building 5 that we're going to be doing in the next couple of weeks. But that's about it. Unless there's any questions, that's my report. There's a lot of work going on, but there's not a lot to report right now.
Thank you, Ken. We've all marveled at watching that building go up for sure. Susan, do you have any kind of closing thoughts before we close for today?
Thanks, Brent. Well, this has been a meeting full of information. I'm really grateful to all of you for participating. Thank you to Lisa, to Terry, to team Ken for presenting all this information about COVID and the building projects. It just gives me a lot of hope and inspiration for the future. And with that, looking forward to seeing you all next month at the Management Forum, but also between now and then out there with our patients. So take care and have a lovely day.